My name is Brian. I work in the pharmacy and I also work with the School of Pharmacy and Biomolecular Science in the Royal College of Surgeons in Ireland. We provide pharmacy service to patients in the hospital, so that's to mothers, babies, gynecology patients, infertility patients. We are medicines experts, so we have quite a bit of experience around medicine use in pregnancy, particularly high-risk pregnancy. And also medicines use in very sick neonates. So we support safe and effective use of medicines. We support patients with their use of medicines, and we also support our colleagues in terms of using medicines safely and effectively. So if you're on medications and you want to get pregnant, it's very important that you don't abruptly stop any medications. It's important that you talk to the prescriber of those medicines, either your GP or your specialist, because the conversation needs to happen around the benefits and risks of using those medicines in pregnancy to ensure that the underlying condition is optimally managed and ensure the best outcome for that pregnancy. So there shouldn't be a situation where you stop your medicines abruptly. It should be done in consultation with a health professional. In the event that there's an unplanned pregnancy and a woman is on medications, again, contact the prescriber of those medicines or the maternity hospital and seek advice on the best approach. But abruptly stopping medications in pregnancy isn't the right approach. The first thing to say is that mental health conditions can be common during the pregnancy or the peripartum period. It's important that you don't stop any medications without first consulting your GP or the prescriber of those medicines. There's an important risk-benefit assessment to be done around the use of medications for mental health conditions during pregnancy. If you take depression as an example, there will need to be an assessment of the severity of the person's depression, the past history of response to treatment, and a weighing of the benefits and risks of using the medicine in pregnancy. We don't want there to be an overemphasis on focusing only on potential risks from the medicine, because there are risks also from not treating the underlying condition. That might be issues with recurrence of past severe mental health disorders. There may be issues around diet, adherence with antenatal visits, and other healthy behaviours during the pregnancy if a maternal mental health condition is untreated or undertreated. So it's important that you have that discussion with the prescriber of the relevant medications to see what the right course of treatment is. So there are public health recommendations on folic acid use during pregnancy and before pregnancy. The public health advice is to take a product containing at least 400 micrograms of folic acid, and that should be taken ideally for 3 months prior to pregnancy. Folic acid is essential to help prevent neural tube defects, so problems with the baby like spina bifida, where the spinal column doesn't form properly. So folic acid can help to prevent that. It's important that all people planning a pregnancy receive 400 micrograms of folic acid for 3 months prior to the pregnancy. Some women take folic acid through multivitamin preparations that are designed for use in pregnancy. If you discuss the optimal product for you with your pharmacist or your healthcare professional, they'll be able to help you decide what's the optimal product for your specific needs. So in terms of over-the-counter medication use, so those medications that you don't need a prescription to use, it's best to talk to your pharmacist before purchasing over-the-counter medicines to use during pregnancy. Some medicines are fine to use, so in terms of pain relief, if there's pain that warrants treatment during pregnancy, paracetamol is safe to use during pregnancy. However, other painkillers may not be appropriate to use during pregnancy, so that conversation is important to have with your pharmacist. In terms of other conditions like reflux or symptoms of acid coming up, that's something that should be discussed at antenatal visits